What's up, everybody? My name is Eric. Welcome to my channel, Eric the Tutor. What's up, everybody? My name is Eric. Welcome to my channel, Eric the Tutor. Today we're going to be going through more practice problems, getting ready for your lecture number 2, midterm exam. So go ahead and give these a try. We got 5 practice problems up on the board. So go ahead and pause the video, try them all out. Unpause the video when you're ready to talk about it, okay? Sounds good. All right, true or false, the adrenal glands are suspended by mesentery. So what do you guys think the answer is? So mesentery we can kind of think of as more peritoneal instead of retroperitoneal, because we know sad pucker represents all of the organs that are retroperitoneal. Right? So in this case, we're just going to fill out the first portion. I know the S stands for suprarenal glands. So suprarenal glands, same thing as adrenal glands, so I know it's retroperitoneal. The answer to this has to be false because the adrenal glands are not suspended by mesentery because they are retroperitoneal organs, okay? So just make sure you're ready to know the difference between peritoneal versus retroperitoneal, especially for lab. I remember having some of those type of problems, so just be ready for that. The next one, the anterior interventricular artery is a branch of the blank, and its paired vein is the blank. Our anterior interventricular artery is going to come off of which branch? Yeah, so it's going to come off of our left coronary artery. Left coronary artery. What else comes off of my left coronary artery? We have our anterior interventricular artery as well as our circumflex artery. And then we know my right coronary artery is going to split into a, what do you guys think? Yeah, it's going to split into a posterior interventricular artery as well as a right marginal artery, okay? Now the paired vein for my anterior interventricular artery, that's going to be the mnemonic we know as great anatomists must practice so much. So these are representing the veins. So we have a great cardiac vein, a middle cardiac vein, and a small cardiac vein. My great cardiac vein is paired up with my anterior interventricular artery. My middle cardiac vein is paired up with the posterior interventricular artery. And my small cardiac vein is going to be paired up with the right marginal artery, okay? So that covers this one. So this is going to be anterior interventricular artery paired up with the great cardiac vein. Great cardiac vein, okay? Number 5 says, what makes up the spermatic cord? So what do you guys think makes up the spermatic cord? Well, we learned in lab that the spermatic cord has the ductus deferens. What else does the spermatic cord have? It has my testicular artery. We also have the pampiniform plexus of veins. And for the lecture portion, it's important to know that there's one additional thing that makes up the spermatic cord, and that's going to be my cremaster muscle. All right, so the ductus deferens feels like that al dente spaghetti, so that's the hardest one. The pampiniform plexus of veins is a plexus of veins, so it's many veins bundled together, usually in fascia. And then you have this single testicular artery. That's not the single ductus deferens, so that's how you're going to differentiate those two. And then the cremaster muscle, which is innervated by the, what do you guys think? The genitofemoral nerve. So my genitofemoral nerve has some sensory to the medial thigh. So if I actually touch that medial thigh, that will actually show us our cremasteric reflex. So my cremasteric reflex will actually have the testicles rise when we actually do sensation to that medial thigh, right? So that's the cremaster muscle. That's everything that makes up the spermatic cord. Let's move on to the next one. So what is the opening between the greater and lesser sacs? We talked about this in lab, right? So essentially you can think of as anterior to my stomach, it's going to be the greater sac. Anything posterior to my stomach you can think of as the lesser sac. And if I put my finger, as I was kind of doing in lab, there's going to be a foramen that allows for communication between those two. That's going to be my epiploic foramen or omental foramen. So let's move on to the last one. Which two veins typically join to form the hepatic portal vein? We actually learned something called a hepatic portal dog. And essentially what that means is we're going to have a dog. So here's kind of my dog looking shape, right? Here's a little liver head here and a little spleen tail over here. So anatomically this is the left side of the body, and over here is my right side of the body. So this head represents my liver and this tail represents my spleen. So we're going to have some splenic artery that's going to be draining into my hepatic portal vein. Over here is going to be my inferior mesenteric vein draining into my splenic vein. And then over here I have my superior mesenteric vein draining with the splenic vein to form the hepatic portal vein. So here's the hepatic portal vein. This was my superior mesenteric vein. This is my inferior mesenteric vein. And then this is my splenic vein. Splenic vein. All right, so the two veins that join to form the hepatic portal vein usually are my splenic vein and my superior mesenteric vein. And then those are going to be sent off to the liver, okay? That's everything for this video, guys. Thanks for staying tuned in. We will see you guys next time.